So how are we doing for time? 2 minutes past 6. I think it's in fairness, we can wait till 5 past.
Yeah, wait till 5 past. I think it's a good idea.
Yeah, lovely. So new people have joined. Rachel, welcome. Joe and Sarah, welcome. Hi. We're just trying to find out where people are. We're coming from all over the country, and that's really makes it really exciting. Also finding out if people are going to Women's Conference this weekend and what you do or don't know about the Socialist Health Association. So who have I not spoken to so far? Yes, where are you? Councillor. Oh, you're in Oxford.
Yeah, I'm in Oxford.
Ah, lovely. So we've got a bit of an Oxford, well, either both current Oxford, but also former Oxford in Kathy, who's helping me out with the tech stuff as well, from her new home in North Wales. Do you know each other?
I know Jabu, but
Yes.
I'm not sure if I know
anyone else. Lovely.
I know everyone.
All right, lovely. Joe, you're already a member of the SHA and you are on the outskirts of Leeds. Fabulous. So we've just been having an argument, sort of, me and Tiber, because Tiber's in Rotherham. So we're arguing who is further north. So Leeds is further north. I do accept that than Manchester. But
I'm in East Yorkshire.
You're East Yorkshire.
Yes. Near Hull.
Where?
Near Hull.
Okay, I think that makes you the northernest.
The northeast.
The north.
Possibly.
I believe
there's lots of faces I recognise on here anyway, so that's good.
Fabulous, fabulous. All right, we're doing very well. One more minute and we'll, so it is, I hope, a friendly and informal gathering to find out and talk to Socialist Health Association women, who we are, what we do, what motivated us to join the Socialist Health Association, what sort of campaigning we do, and also what's our ask of the Socialist Health Association now in terms of conference. So, you know, if we do the small presentations, I've just got a small group of us doing presentations, just giving a little bit of background, and then it's questions. And also feel free, what I'm wanting to say is women, feel free to talk about yourselves, feel free to promote what you do and celebrate what you do. We've just had International Women's Day, but let's do it forever. International Women forever, that's what I say. So I think we have reached that time, 5 minutes past 6, if everybody's comfortable. I am going to invite Coral, and you did ask me an introduction, I got it already, and of course my phone has now gone off, and I will be with you in a moment. So Coral Jones has been a GP in Hackney for 30 years, is the current chair of the London branch of the SHA, a member of Doctors in Unite. She's also the Women's Officer for Hackney South and Shoreditch CLP. Take it away, Coral.
Okay, thanks very much. I sound a bit manic, don't I? But our need to join things keeps growing. So I've been campaigning since 2010, along with many others, for publicly owned and staff NHS, paid for general taxation free at the point of use. So I initially joined Keep Our NHS Public and became a Homerton Hospital Governor, that's in East London. We were involved in campaigns to stop downgrading the hospital pathology service and oppose closure of the Borough Rehabilitation Centre. But then I joined the SHA, and this has really expanded campaigning possibilities. As the SHA is a Labour Party affiliate, we have access to Labour councillors, and in London to the GLA members and to the Labour Mayor. Councillors have important borough and London-wide powers to scrutinise changes and cuts to the NHS, and will be very important in challenging the health and care bill. And I know we've got a couple of councillors here tonight, so I look forward to hearing what they're doing about it. The SHA played an important part in mobilising local councillors and patients against the sale of general practices in London to a US multinational company called Centene. So the SHA has strong connections to unions and supports hospital workers to take industrial action on terms and conditions, and very importantly in challenging outsourcing. And we can be on picket lines without violating these draconian anti-trade union laws. Unite led a campaign for Serco outsourced workers at Bart's Trust, who have now been taken back in-house, which is a huge victory. And at the moment, SHA members are supporting security staff at Great Ormond Street, who are still in dispute and again trying to be taken back in-house. We've passed the zero COVID motion at London SHA, and we speak regularly, a couple of us speak regularly in meetings to retain protections for workers and the public. We campaign on what the so-called wider determinants of health, such as environment, housing, and fighting hospital bed closures. So we oppose the building of the Silvertown Tunnel in East London, the expansion of the North East London incinerator in Edmonton. And I see these kind of campaigns as really important in terms of being health campaigners, because once we've got these things, we just have air pollution forever. In terms of the Labour Party front bench, London SHA has a mental health subgroup. We're going to be meeting Rosina Allen-Khan next week to discuss Labour Party policy. SHA London supports the front bench in their call to oppose the Health and Care Bill, and we seek to ensure that this remains Labour Party policy through our campaigning. So there's much to do, and it's great to see some new people here and join us in fighting for a public NHS and care service. Thanks very much.
Thank you very much, Coral. I was taking notes there. That's really interesting, particularly the mental health subgroup, because it's something I wish we could have in Greater Manchester. It's an area of great interest for me. Let me just bring us back.
Expand it to be general, yeah.
That would be lovely. Right, I'm trying to do this thing where I bring us back to all so that I can bring in the next person. And for some reason, I'm failing. That's it, because I have to go to this button and go to full screen gallery. Yes. Hello, I'm back. I am great at this technology. Honestly, I'm smooth. So thank you, Coral, for opening us up. I'm now going to go over to Oxford and bring in Jabu Nala Hartley. Jabu is the chair of the Oxford Living Wage Campaign. She's also the chair of the Oxford Labour Party and a local city councillor. She's been a long-term advocate and member of the SHA and is also the founder of Ubuntu Mothers for Justice. So Jabu, if I can bring you in now, that would be fantastic. I'm just going to pin the video on you. Everyone's aware, because I did send out the message, I think. Is the spotlight gone on to Jabu? Okay. Can everybody see?
Hi.
Jabu? Yes. Welcome.
Thank you, Ekwaya. Good evening, everybody. Yes, as Ekwaya said, my name is Jabu Nala Hartley. I am based in Oxford. We are, I would say, we have a really strong, proud socialist, frontline here. We've recently just taken over the Labour EC in our Oxford district. So I'm quite proud of that. I'm mentioning that why? Because this is really central to who I am and my campaigning. Although my roots date back, I trace them to South Africa. I was raised in South Africa under apartheid. So my drive to sort of challenge injustices in health, racism, wherever, it's something that I was brought up with by a mom who was a trade unionist, first Black woman general secretary in South Africa. The first thing I want to say is that I joined the SHA in, I think, 2016. So I've been a member for a while, but one of the motivation for joining SHA, I worked in the NHS as a precarious worker for various outsourcing companies, such as the Clarion, which was later disbanded. I've worked for the hospital itself as NHS. I've worked for the, sorry, it's just slipped my mind. But I've worked as an outsourced worker, but mostly not as a clinician, but in administrative roles and also as a cleaner. So I saw firsthand in how workers were treated in terms of workers working under the most horrendous conditions where they had no rights. The workers that were contracted to work, their contracts were constantly under threat, but it was even worse when you came in as a gig worker in terms of your stratification, where you could be dismissed at any time, that sort of insecure type of work. I joined the SHA because I was interested in this Socialist Health Association. Anything that said anything about socialism, I really wanted to know what exactly was their angle on this fantastic system, which for me, I grew up knowing that socialism could bring fairness to our lives, especially as far as equalities and equities in some of our really downtrodden communities. So my campaigning is really, really quite broad, because as much as I am part of the SHA, I am really kind of focusing on different issues that affect our communities as far as inequalities are concerned. As Ekwe said earlier, I'm the chair of the Oxford Living Wage campaign. So we campaign for the Oxford Living Wage, but it doesn't mean that we accept what you call the speculated wage. We truly believe that the standard of living in Oxford is really expensive for low-paid workers. So it needs to be really addressed in terms of how much people are paid here. It's really sad. I was speaking to a friend of mine yesterday who works as an administrator, who's now worried about the new energy bills, where she talked about she's worried that after everything has been taken from her, she'll only be left with £200 a month. This is a worker. This is it's absolutely disgraceful that in the UK people are being pushed into that kind of corner, and she's even thinking about she has to leave Oxford because of the disparities that she has to face for her children and for herself. So my part of campaigning really also means going up and down the country and just raising awareness and just instilling, joining solidarity campaigns to really trying hard to actually establish a powerful workers movement, can fight for our rights. And I believe it's got that element, but throughout the sort of pandemic, we've tried to, me and some of my colleagues, we've tried to address this through various issues, especially the vaccines. I led on the Why Vaccinate campaigns, which were taking place in Oxford. I joined the strikers at the Banbury JD, which was about the fire and rehire. I joined the Royal Kingdom workers in Reading, who were fighting for pay rise and against outsourcing. There's also plenty of campaigns in Oxford that have been taking place around this and Mungos and their outsourcing of workers. It's huge. We've woken up early in the morning with my colleagues, Mark Ladbroke, one president of the Socialist Health Association, fighting for NHS pay justice and trying to show the frontline workers that we stand with them. We stand with them in fighting for a pay justice.
Yes, and I think it's really, thank you, Jabu. I'll let you continue, but I think it's really important that one of the things the SHA does really well is it sees its position in terms of health, how it's impacted by so many other issues and the sort of activism. If we can come back and dig into that a little bit more in the second half of the session, that would be fantastic. Is that okay? Thank you very much for your contribution. Right. So I'm going to come back out to the gallery. And I'm going to invite our third speaker, so Teresa Clark. I've got this list here. Oh, I've also got a new phone. So Teresa Clark is the current chair of the Women's Conference Arrangements Committee, WCAC, or as people call it, and is on the ballot to continue this year. She was one of the key instigators of the conference being reinstated and led on the Telford AWC 2019, which I didn't get to, and I hear all the time women just so thrilled about that first in-person conference after such a long time. So I try not to listen to it because I just get jealous. She's just joined the SHA to help us battle for health and social care equity for all. Over to you, Teresa.
Thanks. Thanks so much, Aqua. Thanks so much, Aqua. Thank you all for being here, and thank you, SHA, for inviting me. It's my daughter's birthday today. She's 35. 35 years ago, to the beloved day, I gave birth to my daughter, and the hospital bed broke apart underneath me, and there were no epidurals left. The NHS was underfunded in 1987, and it still is in 2022, with privatisation an ever-growing threat. 3 weeks ago, my partner had an eye operation. The NHS clinic, underfunded, understaffed, sent them to Specsavers. Free at the point of use, yes, but with our NHS tax money going into private profits and private pockets. I joined SHA to fight for our NHS and against privatisation for my daughter, my granddaughter, my partner, and for all of us. I'm especially glad of SHA's stress on equalities, be it their analysis of racism in health or their stand against the attacks on healthcare for our trans siblings. I'm also a trade unionist. I've been a trade unionist since I've been a shop steward since 1971. And I was very active in our local Save Lewisham Hospital campaign, which we won. We prevented the closure of accident and emergency and maternity provision at Lewisham Hospital. Massive campaign with health unions, with local communities, and with the TUC, which I'm proud to be a Unite delegate to our local TUC. Equalities is my priority, and I'm standing for Women's Conference Arrangements Committee again this year, after 5 years as chair and vice chair, to protect our Telford wins. Telford is famous amongst women in the Labour Party, and maybe even wider, because it was the single most diverse and inclusive event that the Labour Party has ever held. And that's because of the double delegate diversity provision that means that any CLP can have 2 delegates so long as at least one of those sisters is a woman of colour or disabled or lesbian, bi or trans. Obviously, that's partly about the diversity of conference itself and representation and listening to voices which are hardly heard, but it's also about the ethos of our CLPs, because we want to support CLPs in being places in which sisters feel confident and comfortable in their identities and in declaring their identities and saying, I'm disabled, as indeed I am disabled, you can't see it, but I am disabled, I am a lesbian, whatever. If re-elected, we were asked about our ask of SHA. If re-elected this year, I'll work with SHA and with Socialist sisters on the National Women's Committee, like Aqua, to offer regional and in each nation events for women around the country, including a focus on health, on women's health, and on health equalities. Thank you for having me.
Unmute. I have to mute because I'm coughing at the moment. We fingers crossed that's all okay. Thank you very much. I wanted to actually say as well from the previous one. So the Socialist Health Association absolutely fights for and wants to safeguard the National Health Service, but we don't do it uncritically. We recognize that there are problems. We recognize that particularly issues around race that Jabu mentioned earlier, but we don't want to see them used as an excuse to privatize the NHS, but we're not we are a critical friend, not an uncritical friend. And we're trying to do that for our shadow cabinet. And that's what part of this is about. So thank you also for that link. I think it's really important. This meeting was about why Labour women join the SHA. I think it's why all women should join the SHA, but because of this, you know, they've got conference coming up and it felt really important for us to understand why, how the SHA fits into the picture of our wider campaigning. Right, I'm going to bring in Andrea. I have to come out of this so I can find you all. Andrea Gilbert. Right, I have a lovely bit of spiel about you as well, Andrea, and I keep touching the wrong button on my phone because it's also a new phone. So Andrea is a community organizer and housing caseworker for Unite. She's a delegate to the Wandsworth Trades Council and a Labour councillor candidate for West Putney for these upcoming elections in May. She's recently set up a health and homelessness working group within the Socialist Health Association.
Hi everyone, thank you for having me here this evening. I am currently on my way to doing an action against the Tories, so sorry if you hear a lot of cars. I'm currently outside and we're going to be getting off in a bit. But yeah, I joined the Socialist Health Association this year. I have been working a lot on NHS campaigns, so I've been supporting We Own It, Just Treatment, Keep Our NHS Public, and my union Unite as well. In terms of why I'm here, well, I'm also the secretary of Labour Homelessness Campaign, and we have been fighting for our homeless to be registered for GPs and also to get the vaccination. So funny enough, yesterday, NICE actually put out new guidelines as well for homeless people to get extra support into health services, and also ensuring that the health services that they are provided actually meet their needs as well, and also comes, you know, depending on what needs they actually have. So in terms of, you know, their physical health needs, mental health, and obviously signposting them onto relevant services that can support them. Yes, I have recently just set up the Socialist Health Association's homeless group, and it's coming along nicely, actually. We are we're in the process now of having a WhatsApp group set up, and more of the Labour homelessness campaign are also joining the Socialist Health Association, which is good for us as well. So it gets more people organising, and also gets more people focused on homelessness and the actions that need to be taken to ensure that this group of people actually get the support that they need. And it's not just, you know, a sometime-ish thing as well. We need it to be consistent, because people are literally suffering. For example, 78% of the homeless actually have mental health issues, and the majority of them actually have physical health issues as well. So that's pretty much it from me. But if people do want to join the WhatsApp group or join us in what we're doing, then please get in touch with the Socialist Health Association and they will forward it on to me. Thank you.
Thank you, and good luck for where you're going. I'm assuming you're having to get off now. Thank you, Andrea, very much for your contribution. We probably have a couple of other people coming in. Sorry, let me just go to the gallery again, who are out and about on activity. I'm not sure if Irene's joined us. She's over in Liverpool, and she's organising for Blackpool the challenge to the Tory party conference in Blackpool. I think that's a whole series of events starting tomorrow. I'm not sure she can join us. So I'm going to leap again out from London, which is where Andrea was, if you couldn't tell from the accent, out to Rotherham. We're going out to Rotherham in Yorkshire to Taiba Yassin. Taiba, are you with us? Hi. Yes.
I am. Hi, everybody. I'd quickly left just to go and get a drink. The virtues of virtual, meetings. I thought it might be useful just listening to the speakers. It's been nice for me because I don't know everybody on this call either. Is that why we became members of SHA? We all go to a lot of meetings, and a lot of meetings become talking shops, and it's like this circular conversation that we have. And I remember in that first year of the pandemic and everything that was happening to most places where we would access support, I just knew then the NHS was something very important to me. That inspired me to join SHA, because when I did my research, I'm really interested in joining policy forums that have some influence. Otherwise, we're literally not making anything happen. It's still nice to speak and give solidarity to one another, but also now we need action with that conversation. And that's what eventually, doing a lot of research, and there was a lot of call out to have more diversity in SHA. And I can only talk about the kind of more Yorkshire kind of perspective on this, that I responded and I joined. I should give you just a bit of background. I work for the University of Sheffield. I actually work at the medical school. I help to run the programs to represent underrepresentation in medicine. So that's kind of, it's nationally known as widening participation. So that's kind of the area that I work in. I also am a counsellor in Rotherham. I was inspired to go into politics after in my town where I've lived here for most of my life. We failed local people. We were known for CSE, which many of you read about, child sexual exploitation. And that really was, I'd been a member for probably over 12, maybe 13 years at that point. And that was my kind of slow journey into maybe I need to become more active. So that's how I got into politics. And now it eats up my entire life, I feel like. That just gives you a little bit of perspective. My historical background is voluntary community sector. So when I joined SHA, interestingly, I was talking to a lot of my students. I'm in a quite a privileged position at work. I can talk politics, the nature of the work, and low level politics, obviously. And interestingly, the vice chair of the Yorkshire and Humber part of SHA was until last year a student of ours at the medical school, and with him we created this idea of going out to different CLPs and said, look, if we're trying to, the reason I came into SHA was to how can we strengthen this idea of influencing policy around healthcare, then actually we need to educate people more around this possible forum. So we, through the Yorkshire and Humber, we did a number of sessions with CLPs, all virtual, so that it did make it easier doing it virtually. So that kind of campaigning, I think there's an element of campaigning internally as well as externally. Internally, how do we make this stronger so it continues to have and influence the front bench? Because if we're not doing that, they're going to lose people like me, because I'm just interested in how do we get our health policies reflecting the wider communities that we represent and mean something to us. And just to give you a few of the campaigns that I'm really interested in taking forward, and how I take the work of the SHS and the things I've learned from other members. So one area is that, learning, even though I may be a woman of color, I've never had children, and I had no idea the desperate situation that women find themselves whilst giving birth, and the choices and difficult choices that they have to make. And I knew that in my counsellor role, I took on a role of the chair of the Health Select Committee to pursue certain perspectives that had been missed for many years. So just recently, just a couple of weeks ago, I led on a work with the hospital to do a review of their maternity services, so part of the scrutiny function. And that's the first time that had ever been done. And a particular request as part of that was to have a race element to that presentation. And that was not easy. People don't like using the word race or the word black, even if that's on the agenda, which has been an interesting, things to discover, even where we are in history now. And that conversation has now meant that that would be something that we will keep an eye on. I'm just interested in what can we influence to bring people in to talk about it. If it means part of that means put in a bit of further scrutiny on an issue, which is about equitable services, and I'm interested in that. And I know if SHA membership hadn't happened, I might have not been fueled in that way to pursue that as part of my councillor role. So I just want to, maybe for new members who are interested, well, how can they use this forum? That's been great. One area which is a very new thing, which I'm passionate about, and we've talked about the privatization of the of healthcare, or it's already happening. It's not like, oh, it's going to happen, it's happening. And one area is, like many people, I've got a long-term health condition, so I had it from personal experience, is access to medication. Some of you may be aware that some people who've got long-term health conditions, we have an opportunity to, we all pay for our medication, but we can buy a long-term, it's like a subsidized process where we can buy a certification that allows us to have as many medications in a given month, and we get charged a monthly fee. I think it goes up every year. So I think it's something like maybe £12 or something like that at the moment. One of the things I noticed in the last few years is that as part of my annual drug review with my GPs, it's not the GP fault, this is all policy, and particularly Tory policy, is that I was constantly getting told I can't have X, Y, Z, I have to pay for it now. And I'm like, yeah, but you're charging me double. And so I would counter the argument. And it taught me a big thing fighting that is they're not used to people asking questions. Most people that we speak to, or someone can be very vulnerable when they're in the healthcare. They don't want that argument or that debate or that discussion. And I realized the pharmacy was having the discussion with me, was not used to it. So when I was asking her questions back, she was like, well, I'm really sorry, but I just got to ask these questions. I said, well, can you feed back that I'm not going to pay for those things, and I will challenge it because I have right to have this medication. And so one of the things from that is a campaign around those things. Then some of the changes are happening don't seem huge, they seem very little, and they're almost hidden unless you're experiencing it. And that's a really important thing about healthcare. Some of it is very under the belly, but where some of our biggest fights are, and the pushback needs to happen. So that's one campaign that I'll be bringing to SHA, and how do we challenge some of that process to the CCG. Second one is actually for counsellors, and I discovered while being a counsellor is that we don't have, when we go for into hospital for medical care, we may have a legitimate sick note, that none of that is recognised. I don't get a dispensation when I go into hospital. If I miss a meeting, it's just classed as I've missed a meeting. It's classed as the same way somebody's gone on holiday, somebody visiting somebody, somebody deciding just not to go that night. And I don't agree with that. How can we be a party about some of the socialist values that we have, and that is something that's not recognised? It puts a greater scrutiny on what we really mean about support around disability agenda and furthering that agenda. In the end, it doesn't affect me. I turn up to most things. However, I know it's affecting some people. So that's I really do believe SHS has got a unique role in how do we, for people who are elected to positions, for when they've got legitimate reason not to be somewhere, for that to be recognised. And it's not recognised in process. Good thing is some things are. So for example, maternity leave is now, but somebody fought for that. Somebody challenged that. That's not like being there forever, that recognition in the process. Just shut me up, Ekwa, because I'm mindful of time. So I'm happy to leave it there, but I suppose I just wanted to focus on where I'm taking action, but also to influence others. If you're interested in any of those challenges, I would really welcome some kind of collaboration on some of those things.
Yeah, and that's lovely, because that's what I want this meeting to do, is to draw people in and tell us where we want to go, and for us to share that as well. That's really interesting, that last point that you were saying, because I am on the National Women's Committee, and it's a really odd role. So a lot of it, I'm actually just going out there independently because I'm the vice chair. I can do that, trying to support women. And because our overarching role is to support women in the party, particularly into leadership roles, I'm a councillor myself, but I'm 60, so I'm past. I have other issues, but I'm past childbearing, for example. Now, maternity leave is not actually standard or across the country. Unfortunately, I was supporting a councillor in Suffolk, and she had been fighting to get her maternity leave recognised from before she was actually pregnant. She's the only person of childbearing age on the council, which I think is another issue as well. And it never got passed. And in the end, her absence was just noted as absence, like you say, rather than that she was on maternity leave.
Absolutely.
And it became to a point where she actually gave up being a councillor. And these are the sorts of things that me on the National Women's Committee needs to be able to fight and recognise in terms of women. It's all very well us saying we want women in leadership positions, but women are going to be impacted by a lot of things and I think that partnership with the Socialist Health Association is one of the things I hope to do, because I'm on the National Women's Committee, I'm the vice chair, I'm also within SHA, I'm the National Equalities Officer. I want to really make sure that there's a real crossover. It's a bit of the opposite of that stealth. It's a different stealth way, because we are struggling in terms of being able to bring these policy motions to our front bench. We're really fighting that. But I think there are other ways as well to get into the Labour Party and raise these issues, and particularly around women's health issues. And because we have that mandate to look at women's leadership, those two things have to go hand in hand. Thank you very much. I'm really aware
in Rotherham we do have, it's been recognised now recently,
and in
maternity leave. So and that it does help that we had 4 new babies, which is very unusual. I know. we've got a slightly younger cohort, which I love, and which is wonderful that we are able to provide that and cover as well for certain roles. So it's a learning. We've had to adopt it and then see how it works. However, a lot of things still not, and it's not about local. It's about how the national party is viewing these agendas, and they're not viewing them.
Absolutely, thank you. Time is ticking, but it's fantastic. I'm really enjoying listening to what these amazing women are doing and the ask, and I can't wait to involve everybody else in this. We've got 3 more presentations, and then I'm going to open it out to the floor a little. So we're going back to London. So we've gone to Yorkshire, we're going back to London. And Hile, if you would like to tell us a little bit about why you joined the SHA, I can do you a background intro. I have got that. Oh no, I don't.
I can do it if you like. Okay, don't worry.
Please.
So I am a first generation immigrant, and I think that's something that's really important for me. And I have been working in the NHS for the last 10 years in various roles, in policy roles and operational roles across London, in national policy roles. And what I think what is really interesting, and within the SHA, actually, I'm one of the vice chairs of the national SHA, and I think so what is really interesting for me is that NHS is something that I have a great love and admiration for, and I think in some ways, if you have used the health service in other countries, then you tend to appreciate NHS more, that kind of. So I have lived in America for a year with my family in the last 10 years. And also I'm Iranian, where we've got a very, for the most part, we've got a privatized healthcare system. And actually the relationship that you have with your healthcare providers within the NHS really is something that you really value. It does, when your doctor or your nurse or any other healthcare provider tells you something, you don't necessarily need to believe them, but what actually, and they might get it wrong sometimes, and they often do, but what will always be true is that they are giving you the best advice possible in the context of what they think is for your health needs, rather than what would fit best within the context of your health insurance and all the other disparities that might be happening. So in that context, when you have used other healthcare systems, you really appreciate the NHS. But what we do have a real problem in the NHS, both in terms of employment rights, and also in terms of how we treat our patients, is a real disparity and racism and inequalities that, it's a day to day, and the inequalities that you face within the NHS as an NHS worker, if you're a person of colour, then that translates itself in the care that you provide for people. So I can give you an example. In the NHS, in the mental health sector, a lot of our, in fact, I was going to say a lot of our nurses, a lot of our mental health nurses tend to be from very diverse ethnic background. A lot of, particularly in London, we've got a lot of Black or Asian nurses. And in fact, that pretty much applies as well. Psychiatry, specialities, which has a high proportion of Asian doctors. But actually, that does not get reflected in the policy sectors. So when you go to NHS England, in where policy decisions are being made, you do not see many senior ethnically diverse policymakers. You do not see many senior doctors of colour. You do not see many senior nurses of colour. And I think, this is something that actually it makes for poor policy decision making, and we are not particularly good at, in the NHS, we are not particularly good at co-production and working with communities to produce services. So for instance, one of the big things is that if you look at a lot of the patient engagement work that happens in the NHS, you would be hard pressed, and this is London, that I'm talking about London, in an incredibly ethnically diverse city. You'll go to patient representative groups. Often they're often men, but actually a lot of white middle class men and women of kind of retirement age. This does not represent me in any shape or form, and it's important. It doesn't represent me as a mother of a young family. It doesn't represent me as a woman of working age, where the hours that the service needs to be open and how I would want to receive the service would work for me. And it doesn't represent me in terms of, for instance, my religious identity or my other kind of ethnic identity. So for instance, one of the issues that has been a big thing, and if you speak a lot about with doctors of doctors who deal with end of life would tell you that how we organize end of life conversations, end of life, preparing the family and preparing the person, all of those things are done with view of patients who are white. And it's not surprising, because if all of the conversations are happening with people who are white, then it's not surprising that then the experience of people of colour is very, very different. So that's where I've been interested in the SHA. I think, unfortunately, the Labour Party is, I have to admit, as a Muslim woman, I feel that it's an incredibly Islamophobic party. And I think that has been my personal experience, and it's an experience of, you know, the latest report by Muslim Labour Network seems to say that that's an experience of a lot of Muslim comrades. And I think it is really important for us to actually push the health agenda in that direction as well. We already know what happened during COVID. And at the beginning of COVID, I think, you know, the impression was this is all about diversity of income and income inequalities and all of those things. But actually, it turned out that if you're a BAME doctor, you're more likely to die of COVID. A BAME doctor is probably getting, you know, even if you're a consultant BAME doctor, you are more likely. And all of those things are things that I think is the duty of SHA and duty of our campaigning. And that's where my interest is. And I run the race and racism group within the SHA, and I would be keen to have these discussions with anyone who is interested to have them, or if they would like to join the group. Thank you. Echo, I'll stop because you know me, I can go on.
No, thank you. And that, yeah, absolutely. I think it's probably being clear. We have a series of structures in the SHA that are set up last year by the newly elected Central Council, looking at specific areas of interest. So earlier, Andrea was saying about setting up a new one around health and homelessness. I chair the one that has sort of drew together this event, but also an event we had earlier about an introduction to health inequalities, which is the health and social care inequalities steering group. There are numbers of others. Some of them are very practical, some of them are about campaigning generally, about comms, but you know, there's a lot of opportunity within the SHA to actually get involved and do stuff. So I know that Akile's invitation to join the race and health group is a genuine one, and if you're interested, she would welcome you. So I'm going to continue. I know time is going well. We've got 10 minutes to 7, and I have two really interesting speakers, and I know I've also got other speakers in the crowd to join us. In the crowd, you can tell where am I, at a sort of concert or something, somewhere wonderful, and not being able to operate how to change my view. So I'm going to ask Catherine. So we're coming out of London again, and we are going to recently arrived in Cardiff, but Wales based since I've known her, Catherine Thomas. I'm going to let you introduce yourself. Is that okay, Catherine?
Yeah, of course. And it's absolutely terrific to be in such an enthusiastic and interesting bunch of women. It's brilliant. And I have to say, because I first got involved with the SHA probably in the early 90s and was a council member from 2018 until I resigned in 2020, and some people might understand why that happened. But I mean, the number of younger women who've joined the SHA and the diversity, I mean, the energy, you can feel it. And I think the SHA Council average age has dropped significantly, and that's what we really needed. You know, you can get a bit moribund if it's just people my age, you know, and older, because we've seen it all before, and we don't have the ideas and we don't have the enthusiasm. So it's brilliant to hear younger women coming in and you know, taking up the baton. Because when I joined the SHA, I qualified as a doctor and hated it. I hated medical school. I hated working in hospitals. And then my turning point came when I went to Prince's Park Health Centre. And some of you might have heard about the Inspirational Health Centre in Liverpool. And I wanted to plug the book by my GP trainer, Dr. Katie Gardner. She's written a book with Susanna Graham-Jones called A Radical Practice. So if you Google that or look on News from Nowhere, the Radical Bookshop in Liverpool, and that was absolutely inspirational and packed full of ideas of how we can do public health and primary healthcare, how we can do healthcare in general a lot better, and we could really kind of go back to what's worked in the past and that we've kind of lost in the last 10 years. So yes, then I fell in love with general practice and worked in Liverpool for many years, and then moved to the Welsh Valleys, back home to Wales in the Welsh Valleys. And really it's been a combination of learning that what really matters is community, is relationships, is social networks, isn't it? And that we organise together as communities that are open to everybody, that we welcome everybody and we build relationships and take things forward positively. And then we put in place public services that are full of people who are able to do the best that they can, supported to do the best that they can. And I heard somebody yesterday say the most powerful thing as a service provider, whether that's in the health service or anywhere else, is that you are a person who gives a shit. So, when any of us go and use the service, we want to be talking to somebody who cares, and that's the first thing, isn't it? And then you want them to be competent and capable and all that as well. But so I think that those are the two big things, and why I've kind of gone between general practice and public health, because it's those two things. What do you do for a population in a place, and what do you do as an individual health carer? So the only other thing I want to say quickly is that we can really learn from the devolved nations. And Alison here, Alison Schooler, is the chair of SHA Conwy Wales. I have to say, it's great living in a country where you've got a government that's been left of centre since 1999. So policy and strategy is great. We're maybe not so great at implementation sometimes, and some of that is because you're working against a Westminster government, and some of the policies you just don't have the power to be able to make a difference. But also we struggle with funding. Strategies are great, but unless you have the money, you can't make your health service as good as you want it to be. So, but in Wales and Scotland, and we are trying to do the right thing. And it's a great pleasure to be in an SHA where you've got politicians and assembly members who are members at the SHA and active in the SHA. So yeah, if we can share that a bit more, that would be great. So I don't want to say any more because I know we're running out of time, but go and buy a Radical Practice, lots to learn from that.
Fantastic, thank you very much. I'm going to bring in Barbara from London now, but I'm really aware that Alison is in the audience, and also Kathy's also in Wales. But it's really important to hear from Barb. She's a disability activist involved in campaigns across the country. So we're going to bring in Barb now, and we will have a chance to talk with her and then see. I'm happy to stay on for another 10 minutes, but I also want to wrap it up. So it's over to you for your presentation, Barb, and then we'll see where we are with everyone else. Welcome.
Hi, thank you, Kira, and thank you for hosting this important fringe event. Yeah, I was actually a nurse in my younger years before my health problems, disabilities prevented me from doing that. And then, but since I was able to get online in 2010, 2011, I joined the Labour Party in 2011, and I gradually got more and more involved in disability activism through the Labour Party. I'm disability officer, I've been disability officer since 2018, but also in disability Labour and groups outside the Labour Party structure, such as DPAC. I'm also involved with my Unite Community Hackney and Islington branch. So I say I've been trying to make points for quite some time now, because sadly women are still being disenfranchised by their male counterparts in all walks of life. And it's even harder when that woman is disabled, fighting for acceptance and accessibility on all platforms in society. And disabled have borne the brunt of Tory austerity, and before that, I have to say, the Tory austerity for at least coming up to 12 years. We've been hit by financial hardships. Disabled women have taken their own lives, in desperation, because they just can't take any more cruelty from the DWP. And the whole benefit system is a disgrace, which is one of things I've been involved in is scrapping universal credit, both through Unite and TUC Disabled Workers Committee, and also with my own Labour Party passing a motion to scrap universal credit. And health inequalities, disabled face. I mean, during the height of the COVID pandemic, DNRs were placed on them without either their knowledge or their family's knowledge, you know. So, and now we've got we're suffering, the poverty and fuel crisis because of the rising cost of living. And again, it's women who are more likely to suffer most than their male counterparts, facing the choice between heating and eating. So anyway, I joined the SHA back in 2018, partly because as a socialist, I wanted to see socialism put back into the Socialist Health Association, but also disabled women's voices need to be heard now more than ever. And I believe the SHA can be that campaigning vehicle as we try to tackle these health inequalities and benefit inequalities, which will directly impact your health, depression and suicide, mental illness and stuff. And also, we do need policies, and we need policies to be developed at every level with us as equals, not top down and sadly bloke influenced. And I'll finish with this, because as we say, it's our party let us in, and there's nothing about us without us.